first MCQ which I have given you, the facial nerve segment that is least likely. Just read the MCQ nicely. Least likely. So first of all, let us learn the concept. Which part of the facial nerve enhance on the contrast enhanced MRI? One is a mastoid segment, yes. Tympanic segment, labyrinthine geniculate area is very nicely enhanced on the MRI. Tympanic, mastoid, but labyrinthine, yes, very poor. So always remember, if the examiner asks you the least likely, the answer will be labyrinthine. What are the other worth remembering points for labyrinthine? Is the shortest segment. Always remember, is the shortest segment, is the thinnest segment. Because it is the shortest and thinnest, remember the concept, most common part involved in Bell's palsy is here labyrinthine. Am I understandable? So what is the labyrinthine? The part which is crossing from the middle ear, inner ear segment. Middle ear is your tympanic, and crossing from the mastoid will be mastoid segment, what we call vertical segment. So let us learn few other words for tympanic. For tympanic, we use the word horizontal, crossing from the middle ear. Which MCQ will be there? That will be which part is commonly involved in your CSM, in the cholesteroma, which part of the facial nerve is commonly involved. So always remember, tympanic segment is there. Labyrinthine is the inner ear. So 3 MCQs on the labyrinthine. The first MCQ, the answer will be labyrinthine segment. Am I understandable? Coming on the next MCQ. Facial paralysis. Yeah, very nice clue given by the examiner. Facial paralysis in a ear canal edema. So first of all, just remember, if there is a facial paralysis in the ENT MCQ in external auditory canal, we have two possibilities. Either it will be button battery, foreign body, or it will be malignant otitis externa. Now the examiner is giving you the second clue, diabetic patient. No second thought. Whatever the image the examiner is giving you, just go for malignant otitis externa. So what is the diagnosis? It is malignant, so it is caused by, it is not any malignancy, it is infection caused by Pseudomonas. So just remember this point, diabetic word mentioned. Even I have given one more MCQ in the diabetic patient in ENT. Diabetic word go in the favor of 3 diagnoses. Ear, malignant otitis externa. Nose, I have given MCQ, it is mucormycosis. And your oral cavity, pharynx, it is lutic abscess. Now, what are the worth remembering point on the malignant otitis externa? Very important topic. It is caused by Pseudomonas, also known as skull base osteomyelitis. It is also known as skull base osteomyelitis. There is a osteomyelitis on the base of the skull. What is the presentation of this patient? The presentation will be ear discharge with granulation in the canal. Always remember, granulation in the canal with facial nerve paralysis. This patient will be having facial nerve paralysis. So what are the important investigation? I go for 2 important scan. One is technetium 99 scan. Technetium 99 scan. One is gallium scan. Technetium 99, your radiology, you will be learning all these points. Technetium 99 scan is used for diagnosis. And gallium scan, always remember, is used for prognosis. Technetium 99 is for diagnosis and gallium scan is used for prognosis. M for malignant otitis externa, M for medical treatment. Always remember, in malignant otitis externa, we rarely do surgical intervention. And whatever surgery we are doing, it is debridement. Very simple procedure of debridement of this granulation tissue. So if the examiner asks you which surgery we are doing, it is debridement. What is the treatment? Medical treatment. Which drug we prescribe? Always remember, we prescribe 3rd generation cephalosporin. We prescribe 3rd generation cephalosporin. These are the important one-liner with malignant otitis externa. Understandable, caused by Pseudomonas. One more MCQ, clinical integrated MCQ. They can ask you which lab investigation. Like in the medical college, the patient can't afford all these costly scan, technetium 99 gallium. So what we people do, we use ESR. And after how many weeks ESR come down, if my patient is responding, this ESR will come down within 2 weeks. Within 2 weeks, this ESR will come down. Are you getting this point? Coming on the next MCQ, this question going in the favor of malignant otitis externa. Which of the hearing aid is least affected? Read the MCQ nicely. If there is earwax, sweating is there in the external auditory canal, always remember the typical classical hearing aid which we prescribe in the old age, BTE, it is built in such a way that it is least affected by any earwax, any sweating in the external auditory canal. That's why even in the old age, the only drawback is cosmetic. This BTE, behind the ear, traditional BTE, is difficult. It's cosmetically is not accepted, but in old age here is one of the best options. Just remember three advantage: it least affected by any wax, sweating, and it is cost effective. It is very cost effective and understandable. If you compare with the CIC completely in the Canal, is very costly, but yeah, it's accepted cosmetically. In the young patients, we always go for CIC completely in the Canal hearing aid. Which of the following is associated with cochlear recruitment? This is a nice concept. Just try to learn. Your Central Institute, your NEET people, they are fond of asking two concepts. Either they will ask you recruitment phenomena, they will ask you rollover phenomena. So just build up a concept. The rollover phenomena is neural, is retrocochlear, and recruitment phenomena is sensory. Am I understanding? Now, even if you don't know the recruitment phenomena, my dear Damsonians, just the word, I have given you the clue in the MCQ, cochlear. The word cochlear itself is given to you, cochlear recruitment. So recruitment is a property of sensory deafness. So can I simplify this question? Which of the following is a good example of cochlear deafness? Absolutely. Malleus fixation, conductive. Stapes fixation, conductive. Connexin 26 mutation, yes, is one of the possibilities. Second is Meniere's disease. So always remember, this is one of the congenital abnormalities, C option. Meniere's is your sensory. Typical example of Meniere's. Meniere's is typical example of sensory deafness. Meniere's or presbyculosis. So in any kind of sensory deafness, always remember this point. Cochlear recruitment. Recruitment will be phenomena will be seen. Connexin 26 mutation is one of the most common congenital abnormality of your hearing loss, congenital hearing loss. So just answer the Meniere's. Am I understandable? What are the other worth remembering points for Meniere's? Again, like malignant Paralysis Externa, Meniere's medical treatment. We always go for medical treatment. Most of the patient respond by dietary changes. What dietary changes we advise? Low salt diet. Am I understanding? There is extra fluid in the sac. Therefore, we go for dietary modification. Low salt diet is one of the first line of treatment in case of Meniere's. Is sensory deafness. Just remember what is the order of symptom in Meniere's. The first symptom is always tinnitus. Second symptom is vertigo. And third symptom is sensory deafness. So I always give a mnemonic of TDS. Tinnitus, vertigo, sensory deafness, with which is the fourth finding. Always remember there is a fullness of ear. There is a fullness of ear. Okay, fullness of ear. All the students who are preparing for Central Institute, beta, tinnitus, vertigo, sensory deafness, fullness of ear. These are the all important four findings. And these four findings, listen carefully, everybody, all the students listening to me. Tinnitus, vertigo, sensory deafness, fullness of ear. These four constitute one score. Gibson score, Gibson. Central Institute students preparing for JIPMER, AIIMS, this MCQ can be there. So in Meniere's we have Gibson score. What is Gibson score? Very simple. Four important parameters: tinnitus, vertigo, sensory deafness with fullness of ear. Which chromosomes are associated with Meniere's? Always remember chromosome number 12, 6 and 14. These are the three chromosomes. Chromosome number 12, number 6 and number 14, they are associated with Meniere's disease. Clear? Coming on the next MCQ, which of the following is typically seen in a type 3 congenital webs? Now this is again a new fresh MCQ. The first of all, type 3. Even if you don't know the topic, type 3, it means severe stage. Option A and B ruled out. No symptoms, mild hoarseness. This cannot be there. Am I understandable? Are you getting this point? Type 3 glottic web patient will be having severe hoarseness. I have 4 grades, grade 3, grade 4. We always have severe hoarseness. We are talking about congenital webs, which are most common site of webs, as I discussed in my lectures, is glottic area. Which part of the glottic area? Anterior commissure. Always remember, anterior commissure is commonly involved in glottic webs. Is one of the important points. Because glottic area is involved, because here Vocal cord segment is there. Always voice is change. Just remember this point. Voice is changed. Clear? So in grade 3, grade 4, always remember the severe hoarseness will be there. Airway obstruction will be there because there is a web. What is the treatment of this congenital web between vocal cord? There will be a fibrous tissue. So we remove it with the help of CO2 laser. Always remember. Clear? The worth remembering point is commonly seen on anterior commission, and it is because glottic area is involved. Voice have to be changed. So option A and B ruled out. Now it will be option A and B ruled out. Hoarseness, weak cry, we started with exertion. No, is moderate airway obstruction is always there. So D option is the best option. Clear? Among the 4 choices. Question number 6. Again, straightforward. 68-year-old Chandu, diabetic patient with a topic of nose, no second thought, mucormycosis. Just remember this golden word, beta. There is black discoloration. Why? Because it have a special attachment. Special attachment to them is the blood vessel. So always remember, because there is vasoconstriction. Therefore, this patient always have blackish infected areas. Am I understandable? So it is mucormycosis. What is the treatment of the patient? Aspergillosis. We give aspergillosis with debridement. So 2 points. In mucormycosis, what is the treatment? Treatment of choice will be aspergillosis with debridement of the tissue, like malignant otitis externa. Same concept. Even in malignant otitis externa, we try for medical treatment followed by surgical debridement. Same we do in mucormycosis. Same we do in mucormycosis. Coming on the next point, which of the following is true of vocal cord polyp? So beta, try to learn the concept. Whether it is vocal cord polyp or vocal cord nodule, they are at the junction of 1/3, 2/3. Just remember this point. Which are the 3 conditions which are at the junction of 1/3, 2/3? One is polyp, one is nodule, one is glottic carcinoma. Glottic carcinoma. So always remember this point. Glottic carcinoma. These 3 conditions. Now the point is how we differentiate polyp against nodule. Glottic carcinoma will be a typical history. 60-year-old male, chronic smoker, alcoholic, complaining of difficulty in breathing and voice changes because vocal cord is involved. But in polyp and nodule, the history will be like this: 35-year-old, a teacher, singer, complaining of hoarseness. This is a typical change. Are you getting the difference? 70-year-old male, chronic smoker, chronic alcoholic, here teacher or singer, complaining of only voice change. It will be polyp or nodule. Point is, both are at the junction of 1/3, 2/3. So how to differentiate? So just remember the important mnemonic UPS. In your computer system, you have the UPS. Unilateral, P for polyp, S for such. So nodule, they are bilateral. Polyp, they are always unilateral. They are unilateral. Polyp, they are at junction of 1/3, 2/3. But what is the treatment? Always remember the treatment will be your search. Treatment will be search. Always remember this point. Clear? Am I understandable? So how you differentiate polyp against nodule? Polyp against nodule. Nodule, they will be bilateral. They will be bilateral. What is the treatment? Wait and watch. At the junction of 1/3, 2/3. But difference between polyp. Polyp is unilateral. Polyp is unilateral. Treatment is search. We go for microlaryngeal excision. What is the treatment? Microlaryngeal excision will be the treatment for vocal polyp. Will be the treatment for vocal polyp. Clear? Coming on the next MCQ, read the choices. They are commonly bilateral. No, they are unilateral. They arise from the vocal cord ligament. No, it is the mucosa. Always remember, it is the mucosa which is there. They are best assessed by stroboscopy. Absolutely true. They are assessed by stroboscopy. They always require surgical, not at all. We always go for wait and watch. We go for wait and watch. Am I understanding? So the right answer will be, among choices, the right answer will be C option. Will be C option. Coming on the next one, sphenopalatine is related with which turbinate? It's a nice question. I have 2 MCQs in the nasal cavity. Which structure is at the posterior end of infra turbinate and which structure is at the posterior end of middle turbinate? If examiner asks you which is the important structure which is 1.25 centimeter behind inferior turbinate, is the eustachian tube, but sphenopalatine is somewhere 1 to 2 centimeter behind middle turbinate. So just answer of this one will be middle turbinate. Which structure is behind inferior is eustachian tube. So this is the way you learn. Eustachian tube is behind inferior turbinate and sphenopalatine foramen is behind middle turbinate is behind middle turbinate. Clear? Right. What is the importance of sphenopalatine foramen in ENT? Is the most common site for angiofibroma beta. This MCQ expected. Most common site for angiofibroma is your sphenopalatine foramen. Sphenopalatine foramen. Angiofibroma. I just want 1 point should be on your tips. No biopsy. We never ever do biopsy of this patient. We never do biopsy of the angiofibroma. Always remember. Never remove the tumor in pieces. We remove the tumor in toto. Just remember this one. What do you mean by in toto? Completely. So no biopsy will be there. No removing in pieces. We have to remove in toto. Completely. We remove the tumor. Sphenopalatine foramen. Is clear? Coming on the next one. Which of the following statement is not correct about the polyp? Now, first of all, just see what I am showing you. I am showing you two polyps. Bilateral polyp. So first of all, make a concept. What is bilateral polyp? If you see a bilateral polyp in the nasal cavity, just remember this point. Endoscopy, bilateral polyp, it is model polyps. Better, they are model polyps. What are the feature of model polyps? They are bilateral. Allergy is the important factor. Always remember. What is the age of distribution? Model polyp is somewhere 20 to 40 years. Because allergy is the main factor. Better just remember, because allergy is the main factor, therefore reoccurrence is seen. Reoccurrence is a feature of model polyps. Is a feature of model polyps. Recurrence is a feature of model polyps. Why? Because allergy is the main factor. Because allergy is the main factor, just remember the golden statement. Anti-allergic steroids are the first line of treatment. First line of treatment. Clear? So these are the 5 points which should be on your tips. What is the treatment? Investigation choice, treatment of choice, as I say in my lecture, is always endoscopy. Is always endoscopy. What is the treatment? FES, functional endoscopic sinus surgery. What is the investigation of choice? Is your diagnostic endoscopy. Now let us read options one by one. The first option, allergy is a etiology factor. True. Occur in the first decade. No, it is somewhere 20 to 40 years. False statement. Are bilateral. True. They are often associated with bronchial asthma. Yeah, absolutely. Because allergic factor, so they have association with the bronchial asthma. Am I understanding? Bilateral polyps, bronchial asthma, sensitivity to aspirin drugs, hamsters try. So all these things are waiting for you. Okay. Coming on the last MCQ from the pharynx, one of the simplest MCQ, secondary hemorrhage after tonsillectomy. So just remember 3 important concepts. On the table is primary. Within 24 hours, reactionary. And after 24 hours is your secondary hemorrhage. Always remember. Listen carefully, better. Examiner can ask you, secondary hemorrhage occurs after, and second is most common day. If the examiner asks you most common day, it is 5th to 7th day. Always remember. Somewhere on the 6th day, we always see secondary hemorrhage. Primary hemorrhage on table. Reactionary within 24 hours. After 24 hours, secondary. What is the cause of secondary? Always remember, it is your infection. Therefore, what is the treatment? We always go for IV antibiotics. We go for IV antibiotics. Am I understandable? Primary is on table. It is because of injury to the vessel. Reactionary is because of slippage of ligature. Always remember this one. Treatment of secondary, IV antibiotics. So right answer will be C option. So these were the 10 important MCQs. I tried my best to touch all the important topics with the help of these MCQs. But any query you can ask me on, just tag me in the exclusive club, or you can mail me on Dr. Deepak Arora, KM@yahoo.com. clear beta. Very best of luck for all the upcoming examination. Prepare hard. Just remember, class notes, class notes, class notes. Revise. Best of luck. A decent time waiting for you. Thank you for listening to me.